chances are if you've been involved in the sport of weightlifting long enough, you've experienced some aches and pains. Over my years in the sport, I've experienced more than one minor back injury. Following an appropriate rehab and return to training protocol is the collaboration between an athlete, a coach, and a physical therapist. It can also make your comeback a lot faster and less frustrating. If you want a clear-cut way of assessing risk, treating current injuries, and preventing future ones, then stay tuned. In this video, we'll be reviewing common risk factors for back injuries in the sport of weightlifting, what to do when pain occurs, return to training after an injury, and prevention through programming. When it comes to bouncing back from injuries, the collaboration between a coach, an athlete, and a physical therapist is really paramount. That's why I wanted to introduce my good friend and my PT, Zeena, from Good Reps Physical Therapy right here in Brooklyn. Zeena has been a really huge influence in my development as an athlete and also in my evolution as a coach in learning how to understand my own athletes when they are dealing with an injury. She's worked with everybody from weekend warriors all the way up to Olympic gold medalists and will get you taken care of. Great, question number one is, what are common risk factors that you found in weightlifters that might make them prone to back injuries?
So the first thing is your risk is higher if you've had a prior injury, right? With anything, with running, with weightlifting. So no studies specifically for weightlifters. However, if you take a look at studies in back pain in general, people who have less muscular endurance in their back and their abdominal musculature are more likely to get back pain. Additionally, folks who have who scored very low in a VO2 max test are more likely to get back pain. So back endurance, abdominal musculature endurance, and fitness actually is a good predictor of back pain. So if, let's say, you're a weightlifter and you're brand new and your level of fitness is not there, you're increasing your risk for injury. So it is important to be fit in order to...
Because we all think about sports specificity, right? Like, at the end of the day, you have to compete in the snatch and the clean and jerk. But what are the things going into your training program that are going to make you a more robust athlete? Do you have a go-to process for addressing pain once it happens?
I think it's really important to figure out whether or not, one, it's serious. The likelihood of it being serious is quite low. Only 5% of back pain is actually patho-anatomical, which means it's a fracture, it's a spinal cord injury, so your likelihood of being okay is fine. Second, it's making sure that you put out the fire, whether or not that be breathing strategies, manual therapies from a physical therapist, or even just taking a hot and cold shower might help. And then lastly, introducing novel movement, because movement can really address pain.
Zeena, what are your top recommendations for having an athlete return to weightlifting after they've already experienced a back injury?
I think it's important to note that time heals, but time doesn't prepare you, right? So oftentimes what happens is that we take a break and we then get into that loop of I am having back pain, therefore my back gets weak. I go to the lifting, therefore I get pain again. So I think it's really important, one, to test. If you want to decrease your risk for injury, if you can't do 60 seconds of a Sorensen hold, then that's not a good plan. So one, testing. What does your back and abdominal musculature endurance looks like? And then two, track, right? So with weightlifting, especially if you're going back in, you have to see, this is the stimulus I'm given, this is how my body is reacting. So testing and retesting, seeing what you need to do in terms of programming and what you need to do in terms of accessories to make sure that your body, your back, your positional strength is there.
Yeah. So what I really heard and I want to take home in that is that rest alone is not the answer. If you're in the transition process of getting back to training after an injury, then check out my free Back to Strength guide. Final question, what do you look for in a weightlifting specific training program that has a level of prevention to it?
You can't prevent injury. I think that's part of the game, right? Especially if you're pushing for performance, right? However, with working with different clubs and working with different coaches, what I do find athletes who are less likely to get injured are following a program which includes unilateral loading, because we are in a sport that you need to lift equal amounts of weight left and right. Programs that include stuff for positional strength, gets athletes prepared.
Yep.
And then an agile program which helps athletes and coaches figure out what's the proper dosage for the day.
Remember, technique is the medium through which you express strength. So if you're missing that component, then check out my free Intro to Weightlifting guide to make sure that you have the basics of technique down pat. Oh my God!
That was fast.
Thanks for taking the time to chat with me today.
Of course, I'm so happy to be here.
Where can people find you?
We are located in Brooklyn. We are in Crown Heights and Prospect Heights. Thank you again for having me. It's always good to just talk shop because we know it takes a village to raise a champion.
Takes a village. See you on the platform.